Hey everybody, I'm Dr. Max, and we're here today at Dr. Max Restoration Center. This is our brand new facility right by the ocean in Fort Lauderdale. And here's Neal, who kindly agreed to give an interview. You had your procedure back
September 2022.
2022, so it's almost 2 years ago,
Yep.
right? A little bit shy of 2 months. Neal had an FUE procedure. It was a manual using Trivellini device. We planned 2,700 grafts initially, right? And
Yes.
that's what we got. We have 2,700 grafts. We treated the frontal area, we treated the crown area, and now, why are you here today?
So came today for just maintenance. I got PRP and micro SMP done, but I think it's important to help educate people that are looking to get something done with their hair and maintenance and things like that. And I've realized in the last 4 years of being a patient here at this practice, the relationship didn't start and end with the transplant procedure. I came for a consultation and was actually told, no, I don't need a transplant. So I was a little upset about that, but was put on a maintenance protocol of doing PRP sessions. And then eventually after a couple of years, I was sort of then recommended for a transplant because the hair loss had sort of progressed to a point where it made sense. And even then post-transplant, still doing a maintenance follow-up. And I think that's kind of what is important. I wanted to talk about what separates, your practice from every practice, not just here in the US, but even around the world, right? And I've got a clinical background. We actually run clinical trials. And so for us, we're very appreciative of the nuance that you take in your procedures, right? So it's not just, how meticulous you are with the procedure. It's the treatment before the procedure, the treatment after the procedure, the incorporation of hyperbaric oxygen therapy, the incorporation of topical solutions post, transplant. These are all things that I think are part of making hair solutions a lifestyle and not just a one-time fix that is very short term. So I think a lot of doctors don't have that ability to incorporate this many different practices into a single solution, if you will. And I think that's ultimately what drove me to come to this practice and not go elsewhere. I think just having something that was a lot more holistic and a lot more thorough than anywhere else was really what made this a much better experience for me.
Absolutely. And it's a very valid point, okay? Hair loss never stops. It's basically, once you have a hair loss, you're gonna have a hair loss for the rest of your life. So you either do something to control it, okay? In surgery, it's not the way to control hair loss. It's surgery is sort of resetting the clock, okay? So you lost the density, you do the procedure, then you got this new permanent hairs, but the rest of the previous hairs are still subject to hair loss. And this is where the maintenance is important. This is where taking medication, just like brushing your teeth. If you stop brushing your teeth, you will see your consequences of this decision in about 6 months. Same thing with the hair.
I think also the other thing worth highlighting is, your solutions for different things they're actually practical, right? So everyone knows you can take, oral medication to help with hair loss, right? With the miniaturization process. And so, but you don't push that. You push a topical solution that you've been, very instrumental in formulating, right? With other things that are added to it. And so why is that important? It's like, well, I think the one thing that I realized here is how to get maximum result with minimal side effects. And so that's very, I think, forefront of you in the practice to sort of push on topicals instead of doing orals. And it's not just a preference of convenience, it's more a preference of where you're gonna get the better result.
Correct.
And you guys are more into the literature and the research backing all of these things, and now it's incorporated in your practice, and I think that's very hard to find really outside of an academic institution. So as a private practice, you guys bring this level of academia to the table as well, which for me, that mattered the most in making the decision to come here.
We try to address the entire problem from as many angles as possible, right? And I think there is no one perfect solution. So using topical, actually, I've been using it for 8 years, and I'm the perfect tester because I can see what it can do. Looking at my picture from 2015 when I was back in the US Army, it was, during this officer training course, I was really stressed. I had to live in Austin, Texas, in the middle of the summer, suburbs of Austin. And my hair actually looks worse from 2015 than it is now, okay? So, and I've been using it very religiously every day, okay? Which probably you did not.
I was not.
yes.
I'll be the first to admit, which is why I think having this relationship with the practice matters,
Right.
because I think being realistic is not everyone is going to be able to be that consistent. And if you
Right.
don't have a solution that's in your backyard that you can go back to and help fix the problem and course correct, you're out of luck, right?
It's much easier to reach out to me. Even, you don't live in the city, okay, we're still in the same country.
Yeah.
It's very easy to fly to Fort Lauderdale versus flying somewhere like Turkey, okay, Antalya, and get the treatment. In regards to surgery, how important it was for you that doctor was hands-on the entire procedure from beginning till the end? What do you think
that
about
ultimately was the main driver in the decision, right? Is that, your practice, you're doing everything from the start to the finish, and even today, I'm in here today for PRP. I'm not supposed to be seeing you, and I saw you, right?
Yes.
You're checking on me, and again, that's not something that unfortunately is common in medical practices around the world today. So, as far as hair transplant, it's like you only have so many attempts of getting it right. And so you want the person that has the most expertise, the most credentialing, the best know-how of what to do, doing it from start to finish on day one. There's no do-overs in the hair transplant space, I imagine. So
Yes.
you being involved was critical for my decision.
It's a very good point, because unlike other procedures, let's say if you do a bad rhinoplasty, right? It's you went somewhere, you got a bad nose job, okay? You find another doctor who can fix it.
Yeah.
The problem with hair restoration, once the hair is taken from the donor area and it's not growing there, this hair is gone forever, okay? This hair is not gonna be recovered because it just didn't make it. So it is important before you make your decision where you go, and I'm not self-promoting right, at this point. There are plenty of hands-on, trustworthy doctors, and you can reach out to me. I can share their names because we have a very small hair restoration surgery ward, and we know each other, and I know who does good job, and I can recommend them based on area that you live.
Price aside, right? If you're motivated to get a hair transplant, you're motivated to look a certain way, right? For your well-being, maybe it's professional, there's an impact there. It's an investment though in yourself, right? So if price is not a factor, you can go anywhere in the world to get this done. And I had seen 10 other providers, not just in Florida, right? Across the US. I had even looked overseas in Europe, London, and so again, it all boils down to it's an investment, right? So you only have one chance to make the right investment.
Yes.
So, and I think all of these things that we're talking about are maybe things that the normal patient doesn't get the opportunity to realize until it's too late.
Your hairline looks natural. It doesn't look artificial.
That's the biggest thing, yeah.
In hair transplant, we call this phenomenon, it's called a turkey hairline. So turkey hairline, you can recognize from 20 feet if you have a good vision.
Yeah.
Otherwise, from my vision, probably from 5 feet, I can recognize because it's all straight.
Yeah.
It's very thick hair, and it screams, I had my hair transplant at the cheap place because I didn't want to have a real transplant. This is called a turkey hairline.
Yeah.
So look at the Neal's hairline, and it looks completely natural. It looks like if I see you and I didn't know you had a hair transplant, I will never get.
The way that you do, whether it's the density and as far as whether you're doing triplicates or doubles or singles, that was important because that's something that I realized while I was getting the transplant. That takes a lot more time to have that level of sort of care to sort of change from triplicate to double to singles, but the end result is a natural result, right?
Yes.
And so, getting a transplant's not something that you like to advertise, and so why would you advertise it after you got the transplant?
There's a lot of things that I had to develop as an engineer to be able to get the right grafts and disperse them in the right order to make sure that every hairline looks like Neal's hairline, right? So far, nobody guessed, I assume.
Nobody's guessed. Yeah, that's right.
Yeah.
And it's been monumental for my confidence, just starting up in a career, right? These are the things that, again, your hair is a part of your identity, unfortunately, whether you realize it or not. This is by far the best investment that I've made.
Yeah.
Right?
And Neal, he's a very busy guy running a big scientific company, right? You're in front of people all the time, probably need to give speeches, right?
Yeah.
A lot of meetings and so on. So thank you so much
Thank you for everything. Appreciate it.